Betsi is a large health board with vastly different health issues to address. In total, over a period of a year, I think there was roughly 305 sections under the Mental Health Act, where typically police officers will collect you. You will lose your rights at that point and be taken to the nearest hospital for evaluation. 305 is quite a big number in comparison to the rest of the health boards. It is the largest number. There are, headlines saying an extra 600 million is spent in mental health per year in Wales. I do welcome that a lot more is spent on mental health, but the strategy of how that money is spent doesn't seem to be working. Mental health is a community problem, and if people could recognise the symptoms and recognise warning signs earlier, then I think you would see a different trend. Police officers shouldn't be the team that is picking up people who are in crisis. The strategy should be that we're addressing education and discussing our problems at school. Mental health starts when you're a child. You should know your feelings and you should be allowed to discuss your feelings openly. And I think if you were to pursue an education, community-based strategy, you are going to see the benefits. It's quite difficult because Wales doesn't necessarily have a dedicated mental health minister, but I think post-COVID and looking deeper into these results of Section 135 and 136, a dedicated mental health minister that leads a multidisciplinary task force, and that would be coordination with the health services, coordination with social services, coordination with the fire service, coordination with the PCCs. They should have ultimate responsibility and they should be at the front line. They should not be ministers just making decisions. Their office should be held accountable for figures. They should be held accountable for costs. Mental health shouldn't be a cost-driven matter, but clearly 600 million a year additional spending on mental health in Wales is not solving the problem. Something is going wrong.